Over 83 million lives depend on it. Children, seniors, people with disabilities, and families living paycheck to paycheck. Without Medicaid, they don't just struggle. They fall straight through the cracks. While politicians bicker and billionaires hoard tax breaks, this single program is doing the heavy lifting to keep millions alive. So why is it always the first on the chopping block? My award with Politico discusses how House Republicans are considering Medicaid cuts to help finance Trump's big spending bill and propose $5 trillion in tax cuts. However, Trump has repeatedly vowed not to cut Medicaid. The White House is concerned about the political impact of Medicaid cuts and is exploring alternative proposals, such as lowering drug costs by linking government payments to lower prices paid abroad.
Medicaid cuts to help finance his big, beautiful spending bill, and its proposed $5 trillion in tax cuts. Trump has repeatedly vowed he will not cut Medicaid. But what are you hearing about what changes to the program he might agree to? I mean, if Republicans don't come up with the hundreds of billions of dollars in savings they need, what parts of Trump's agenda could be on the chopping block?
Yeah, it's going to be a tough stretch ahead for Mike Johnson, that's to say the least. I mean, he's trying to find all these savings to pay for the rest of Trump's legislative agenda. We know that they're really, really focused on border security and immigration, but there's a lot of other things they're trying to fit into this bill. And like you just said, one of the things they're talking about, Mike Johnson and allies, they're talking about this rolling back part of the Medicaid expansion enacted under President Obama. And Trump has basically told Republicans he's all for cutting waste, fraud, and abuse in the system, but he's really worried about pursuing anything that might actually be viewed as cuts to Medicaid, which he vowed to protect on the campaign trail. I mean, he's even told some of his aides, you know, we learned this, that he's uncomfortable with this idea. And Trump's aides and allies and others who are close to the president have been pointing to polling on this. It is not popular to cut Medicaid. Trump knows this. Democrats know this. The White House knows that that is what they're going to latch onto in terms of attacks. And so they are going to present Trump with this menu of Medicaid changes, you know, the estimates of savings they would generate and also the impacts on beneficiaries. But one interesting thing that we learned is that aside from some of these controversial proposals that some of these House Republicans are pushing, the White House has also asked them to look at proposals that would cut down on drug costs by pursuing a most favored nation policy, linking certain government payments for pharmaceuticals to lower prices paid abroad. But I'm sure you remember, Alex, you know, Trump pushed for this drug plan in his first term, and it faced a ton of opposition from Republicans and the pharmaceutical industry. So, I mean, if there's one thing that's going to drag these negotiations out even further, it's going to be that.
One question quickly, because you also wrote about how President Trump's immigration...
Let's frame it this way. Medicaid doesn't just provide insurance, it's a lifeline. Did you know that nearly 2 in 5 births in America are covered by Medicaid? That's not just a statistic. It's generations being given a fighting chance from day one. Whether we're talking about preventive care, chronic care management, or life-saving surgeries, Medicaid is essentially the safety net for so many who would have no other options. Historically, Medicaid emerged in 1965 to address a dire lack of access to health care for low-income Americans. Fast forward to the Affordable Care Act, and we saw Medicaid evolve and expand dramatically. The Affordable Care Act added more than 20 million people to the rolls, many of whom, before this, couldn't even dream of having regular checkups, let alone vital treatments for conditions like diabetes or cancer. Let's not forget its role in averting financial catastrophe. Medical debt is a leading cause of bankruptcy in this country, and Medicaid shields millions from that grim reality. Without it, folks would be forced to skip prescriptions or delay critical procedures, often risking their lives in the process. When we assess the broader picture, Medicaid is about more than individual health. It's about public health and community stability. By covering preventive services and reducing uncompensated care burdens on hospitals, it keeps our entire system afloat in ways we often take for granted. But this foundation we're talking about, it's facing some significant challenges. Challenges that could reshape what Medicaid looks like, or whether it can even fulfill its core purpose. And here's where Medicaid's future takes a precarious turn. Right now, there are proposals floating through Congress aimed at slashing Medicaid funding, and not in subtle ways. Let me break this down. The most talked about proposal? Per capita caps. This would limit the amount of money per person that states can claim from the federal government, effectively transferring higher costs to the states if healthcare expenses rise. Let's be clear. This isn't just a budget adjustment. It's a direct threat to coverage for millions of Americans. Then there's the push for work requirements. On paper, it sounds logical. Require recipients to meet employment or training conditions. But in practice, it's a logistical minefield. Many Medicaid recipients are already working, some in multiple part-time jobs without benefits. These requirements often add layers of red tape, kicking qualified people off the rolls, not for unwillingness to work, but for failing to navigate the bureaucratic hurdles. Have we learned nothing from states like Georgia, where enrollment plummeted under similar policies? And let's not overlook the proposed rollback of federal funding for Medicaid expansion under the Affordable Care Act. Remember, this expansion brought health coverage to an additional 20 million Americans, many of whom had never seen a doctor regularly before. Reducing federal contributions means states would either cut services, raise taxes, or worst of all, remove people from coverage entirely. What makes this debate even more intricate is the Republican Party's internal friction. You've got hardliners arguing for deep cuts, framing Medicaid as bloated and unsustainable. On the other hand, figures like Colorado Representative Jeff Hurd and California's David Valadao are calling for a different approach. They're advocating for reforms that maintain Medicaid's core mission, protecting vulnerable populations without gutting the program. They stress that children, seniors, and low-income families shouldn't bear the brunt of savings agendas. It's a divide that's playing out in real time. Now, here's where public sentiment becomes crucial. Polling consistently shows that drastic Medicaid cuts don't sit well with the American people. A recent survey from KFF found that over 76% of respondents across party lines oppose significant reductions to the program. It signals something critical, that healthcare access isn't just a political issue. It's deeply personal for millions of people. And as we look to the next chapter in this conversation, we'll see that these proposals don't only affect coverage. They ripple out into state economies, jobs, and the stability of healthcare infrastructure. So let's zoom out for a moment and talk about something broader, the ripple effects of these Medicaid cuts. Because this isn't just about insurance coverage. This is about jobs, state economies, and healthcare systems holding on by a thread. Take Arizona, for example. A reduction of just $1 billion in Medicaid spending there could result in over 36,000 job losses. And that's not just in healthcare. We are talking about ripple effects hitting education, retail, even local government. Meanwhile, New Jersey stands to lose up to $10 billion in funding, putting the health coverage of 700,000 working-age adults at risk. And states like Nevada, well, they've outright said they'd be hard-pressed to fill the void, potentially leaving hundreds of thousands of people stranded without access to care. But let's break it down at the hospital level. Hospitals, particularly in rural areas, heavily rely on Medicaid reimbursements to keep their doors open. When those reimbursements dry up, it's not just about cutting services, it's about shutting down entirely. And when that happens, the entire community loses. Imagine needing life-saving care and having to drive hundreds of miles to the nearest facility. That's the stark reality for millions of Americans if these drastic cuts go through. And then there's the human cost. Imagine a mother forced to skip her child's insulin refill because Medicaid dropped their coverage. Imagine an elderly patient losing access to home care, suddenly unable to stay out of a nursing home, or an individual delaying cancer screening, leading to conditions caught too late for effective treatment. These are not hypotheticals. They are scenarios we have already seen in states cutting corners on healthcare funding. Let's also talk public health. When people lose preventive care, they don't stop needing health care. They go to emergency rooms. They wait until conditions are critical. And that cost, that strain, it falls on every single one of us. Hospitals get overwhelmed, premiums for private insurance skyrocket, and communities lose their safety nets. This isn't just about dollars and cents. It's about lives and livelihoods. These cuts wouldn't just impact Medicaid enrollees. They'd carry a domino effect, shaking the foundation of our healthcare systems and economies nationwide. And this brings us to the real question. What kind of country do we want to be? Are we willing to save a budget at the expense of these core pillars of our society? And that wraps up this deep dive on Medicaid and its ripple effects across lives, communities, and healthcare systems. I hope I've shed some light on not just the facts, but the human stories behind the numbers. You know, sometimes it feels like these issues, funding cuts, debates in Congress, they're distant, far off, but they're not. The choices lawmakers make today will directly shape someone's tomorrow, a child's, a parent's, maybe even yours. So, what can you do? For starters, stay informed. Advocacy begins with awareness. Share what resonated with you from today's episode. Reach out to your representatives and actually tell them where you stand. The truth is, we all have a voice in shaping the direction of healthcare policy. Even just starting a conversation with those around you can create unexpected ripples. I want to thank each and every one of you for being part of this dialogue. Remember, the power of independent media lies in its purpose to inform you, to equip you to ask the hard questions that spark real change. If this episode struck a chord with you today, please share it with someone. Let's widen this circle of understanding, because healthcare issues affect all of us, directly or indirectly. Before I go, I'd love to hear from you. Follow us on social media, drop a comment about what resonated or what you'd like us to unpack next. And if you believe in keeping conversations like these alive, consider checking out The Real 411 on Substack or Spotify. Your support, both free and paid subscriptions, keeps us digging, keeps us honest. So until next time, stay informed, stay bold, and as always, stay real. Take care, everyone.